Skin lesions can be benign or malignant. Benign, you typically would see moles that are concerning to patients. Subcutaneous cysts are very common in that you have parts of the skin glands and hair glands that back up and can become quite sizable, often drain a cottage cheese type of fluid. So that will bring up their concern very quickly, and they'll get it checked out. Oftentimes they're concerned that it is infected and it's an abscess. Other malignant types, cancerous types of skin lesions that we see are basal cell carcinoma, squamous cell carcinoma, and the more aggressive of the three being melanoma. What would typically happen is the primary care provider will send a referral to the general surgeon to evaluate it and to determine if it needs to be excised or biopsied. The best way to determine what type of lesion it is would involve a biopsy of a portion, or if not a portion, all of the skin lesion. That's often done as an outpatient procedure in the clinic.
How often do you see those patients?
I see them quite often, especially with summer coming around. It's something that will raise concern. Certain lesions that have either become bigger or become more symptomatic will raise their attention, and they will want those to get checked out. A good mnemonic device, we use A, B, C, D, E. A for asymmetry, if there's a regular appearance to it, if it's not a clear circular lesion, and if it's asymmetrical, that would be one of them. Borders, if the borders are irregular, again, not a perfect circular, perfect shaped lesion. Color, if the color changes, it starts out a red or a brown and turns to a blue, that would definitely raise concern. Diameter, if the lesion becomes larger in size, something greater than 6 millimeters would raise concern, especially if the growth continues. E is elevation or evolving. Some folks use evolving for E. And elevation would be if it starts flat and gets bigger to where you can feel it with your finger. Evolving meaning that it somewhat incorporates A, B, C, and D if it's generally changing its appearance in a rather quick fashion. The majority of patients at risk would be fair-complected patients where they have a long history of sun exposure, farming, fishing, beachgoers. All of those populations are quite common on the Mississippi Gulf Coast, so this is a quite common problem that we treat for patients.